Turning 60 marks a significant transition in a man's life where health considerations take center stage in determining quality of life, independence, and longevity. This stage brings unique physiological changes that every man should understand to navigate his later years with vitality and confidence. The body undergoes gradual but profound transformations that affect everything from cardiovascular function to hormone production, muscle composition, cognitive abilities, and emotional well-being. While aging is inevitable, how one ages depends largely on lifestyle choices, preventive healthcare measures, and awareness of these 6 crucial health aspects that specifically impact men over 60. First and foremost, cardiovascular health becomes paramount as heart disease remains the leading cause of mortality among men in this age group. The vascular system undergoes natural changes, with arteries becoming less flexible and plaque accumulation potentially reaching critical levels after decades of silent buildup. Blood pressure tends to creep upward due to reduced arterial elasticity, while the heart muscle itself may thicken and pump less efficiently. Understanding key health metrics becomes essential, including maintaining blood pressure below 120/80, keeping LDL cholesterol under 100 mg or DL, and knowing that resting heart rate between 60 to 100 beats per minute is generally healthy. Regular cardiovascular exercise adapts to accommodate aging joints, with low-impact activities like swimming, cycling, or brisk walking proving most sustainable while still providing heart benefits. Strength training gains new importance not just for appearance but for maintaining metabolic health and functional independence. Dietary adjustments should focus on reducing sodium, increasing fiber intake, and incorporating heart-healthy fats from sources like olive oil, nuts, and fatty fish. Perhaps most critically, men over 60 must recognize that heart attack symptoms often present differently than the dramatic chest clutching portrayed in media, potentially appearing as fatigue, jaw pain, or indigestion, which many men might dismiss as normal aging. Prostate health emerges as another critical concern, with benign prostatic hyperplasia affecting about half of men in their 60s and nearly all by their 80s. The prostate gland naturally enlarges with age, potentially causing urinary symptoms like nocturnal frequent nighttime urination, weak stream, or difficulty initiating urination. While these changes are common, they shouldn't be automatically accepted as inevitable consequences of aging, since they could indicate more serious conditions including prostate cancer. Screening decisions should involve thoughtful discussions with healthcare providers, weighing individual risk factors such as family history and ethnicity. Current research suggests African American men and those with first-degree relatives who had prostate cancer may benefit from earlier or more frequent screening. Lifestyle factors influence prostate health, with evidence suggesting maintaining a healthy weight, regular physical activity, and a diet rich in tomatoes, cruciferous vegetables, and omega-3 fatty acids may offer protective benefits. Sexual health, often intertwined with prostate function, frequently changes during this life stage, due to both physical factors like reduced testosterone and blood flow, as well as psychological considerations. Open communication with partners and healthcare providers about these changes can lead to effective solutions and maintained intimacy. Musculoskeletal changes accelerate after 60, with men losing muscle mass and strength at approximately 1% per year, condition called sarcopenia, that can significantly impact mobility and independence if left unaddressed. Simultaneously, bones gradually lose density, increasing fracture risk, particularly for men with low testosterone or those taking certain medications like long-term corticosteroids. Resistance training transitions from optional to essential, with research demonstrating that even men in their 80s and 90s can rebuild strength through appropriate exercise programs. Protein requirements actually increase with age, contrary to common assumptions, with experts recommending 1.0–1.2 grams of protein per kilogram of body weight daily, distributed evenly across meals, to optimize muscle protein synthesis. Vitamin D and calcium become crucial nutrients for bone health, with many seniors requiring supplementation, especially during winter months or in less sunny climates. Balance exercises gain new importance to prevent falls, which represent a major threat to independence for aging men. The combination of strength training, adequate protein intake, and proper nutrition can help maintain physical function and prevent the downward spiral of weakness and loss of autonomy that too often accompanies advanced age. Cognitive health and emotional well-being represent equally vital but frequently neglected aspects of male health after 60. The brain undergoes structural changes, including gradual shrinkage of certain regions and alterations in neurotransmitter systems that affect memory, processing speed, and sometimes mood. While some cognitive slowing is normal, dementia is not an inevitable consequence of aging, with lifestyle factors significantly influencing brain health trajectory. Engaging in mentally stimulating activities that challenge the brain, learning new skills, maintaining rich social connections, and managing stress through techniques like meditation all contribute to cognitive resilience. Depression in older men often manifests differently than in younger populations, sometimes appearing as irritability, fatigue, sleep disturbances, or physical complaints rather than overt sadness. Rates among older men, particularly those who are white and divorced or widowed, remain alarmingly high, underscoring the critical need for attention to mental health in this demographic. Retirement and changing social roles present psychological challenges as men navigate shifting identities away from traditional work-based self-concepts. Developing new purposes through volunteering, mentoring, or pursuing long-delayed passions can provide meaningful engagement and life satisfaction during these years. Metabolic changes create new health considerations after 60 as the body processes medications, nutrients, and toxins differently. Liver and kidney function decline, affecting how drugs are metabolized and eliminated, potentially leading to medication buildup and increased side effects. Body composition shifts, with fat more easily accumulating around the abdomen than without weight gain, while lean muscle mass decreases, altering basal metabolic rate. The body becomes less sensitive to insulin, increasing type 2 diabetes risk, making regular blood sugar monitoring important, even for men without diabetes diagnoses. Understanding metabolic syndrome becomes crucial. This cluster of conditions, including high blood pressure, high blood sugar, excess abdominal fat, and abnormal cholesterol levels, significantly increases cardiovascular risk. Nutrition needs shift paradoxically, with calorie requirements typically decreasing while nutrient needs remain the same or increase, creating a need for more nutrient-dense food choices. Hydration becomes more challenging as thirst mechanisms become less reliable. It remains essential for kidney function, medication efficacy, and cognitive performance. Alcohol tolerance typically decreases with age as the body becomes less efficient at processing it, making moderation increasingly important. Finally, establishing a robust preventive healthcare strategy and strong partnerships with medical providers becomes essential after 60. Recommended health screenings expand to include regular checks for abdominal aortic aneurysm, particularly for men with any smoking history, colon cancer, and osteoporosis, in addition to ongoing monitoring of blood pressure, cholesterol, and diabetes risk. Vaccinations including shingles, pneumonia, and updated tetanus, diphtheria, pertussis shots become important for disease prevention. Hearing and vision checks should become routine, as sensory declines often happen gradually without conscious awareness, leading to social isolation or safety risks if unaddressed. Developing open, honest communication with healthcare providers helps overcome the traditional male reluctance to discuss symptoms or concerns that often delays diagnosis and treatment. Building a healthcare team that may include a primary care physician, relevant specialists, and possibly a geriatrician can help navigate the increasing complexity of health management in later years. Advanced care planning, including discussions about healthcare preferences and designation of a healthcare proxy, ensures a man's wishes will be respected if he becomes unable to communicate them. Understanding these 6 key areas of health empowers men over 60 to take proactive control of their well-being. While aging brings inevitable changes, how these changes impact daily life depends largely on informed choices and active health management. The 60s can represent a time of renewed vitality when men armed with knowledge about their changing bodies and minds make intentional decisions to optimize their health. By addressing cardiovascular risks, protecting prostate health, maintaining muscle and bone strength, nurturing cognitive and emotional well-being, adapting to metabolic shifts, and embracing preventive healthcare, men can position themselves for not just longer life, but better life in their later decades. Successful aging isn't about resisting the natural progression of years, but about understanding bodily changes and working with them to maintain function, independence, and enjoyment at every stage. Men who approach their 60s with this knowledge and proactive mindset often find this can be among the most rewarding chapters of life, filled with opportunities for growth, contribution, and satisfaction, unconstrained by earlier career or family obligations. The key lies in recognizing that while some aspects of health may require more attention after 60, this attention paid consistently and knowledgeably can yield tremendous returns in quality of life for years to come.